Tetanus. What is tetanus? Tetanus is an acute, often fatal disease caused by exotoxin produced by the bacterium Clostridium Titanium. It is characterized by generalized rigidity and convulsive spasm of the skeletal muscles. Muscle stiffness usually begins in the jaw, that is, in the form of lockjaw, and it descends down in the rigidity in the neck and becomes generalized rigidity in the body. Tetanus toxoid developed in 1924, which is used to prevent the tetanus. It was first widely used during the World War II. After three doses, almost everyone is initially immune, but additional doses every 10 years are recommended to maintain the immunity. A booster shot should be given within 48 hours of an injury to people whose immunization is out of date. Since 1998, WHO has recommended that tetanus toxoid should be replaced by the TD, that is tetanus and diphtheria vaccine. Till now, 133 countries have replaced TT with TD vaccine. Till now, we are using TT only in India. What is Clostridium Titanium? It's an anaerobic, gram-positive, spore-forming bacteria. The organism is sensitive to heat and cannot survive in the presence of oxygen because it's an anaerobic organism. Spore can survive autoclaving at 121 degrees Celsius for 10 to 15 minutes. The spores are widely distributed in the soil and in the intestines and fecal material of the horse, sheep, cattle, dogs, cats, rats, etc. What toxin Clostridial tetani produces? It produces two variants. Clostridial tetani produces two exotoxins. One is tetanolysin and second one is tetanospasmin. Tetanospasmin is a neurotoxin and causes the clinical manifestations of tetanus. Estimated minimum human lethal dose is 2.5 nanograms per kilogram of the body weight. So 175 nanograms is the required to become fatal for a 70 kg body weight person. Coming to the pathogenesis, Clostridial tetani usually enters the body through a wound only. In the presence of anaerobic conditions, the spores germinate. Toxins are produced and disseminated via blood and lymphatics. Toxin binds in the central nervous system, interferes with the neurotransmitters released to block the inhibitory impulses, leads to unopposed muscle contraction and spasm. Coming to the clinical features, the incubation period is usually 8 days, with the usual range from 1 to 21 days, based on the injury site. We do come across three kind of manifestations. One is generalized, which is the most commonly seen in 80% of the cases, and sometimes we can see a local manifestations or cephalic manifestations. Coming to general manifestation, usually presents with a descending pattern. It presents with a descending pattern. Initially, trismus will develop or lockjaw, followed by stiffness in the neck, difficulty in the swallowing, rigidity of the abdominal muscles, temperature, sweating, elevated blood pressure, episodic rapid heart rate. Spasms may occur frequently and last for several minutes. Spasms continue for 3 to 4 weeks. Complete recovery may take months together. Coming to the localized form, a persistent contraction of the muscles in the same anatomical area as the injury. Contraction may persist for many weeks. Localized tetanus may precede the onset of generalized tetanus but is generally milder. Cephalic, occasionally occurring with the otitis media. Following the injuries to the head, involvement of the cranial nerves, especially in the facial area. Coming to the complications, tetanus may land up with laryngospasm or fracture due to the generalized severe spasms, hypertension, and or abnormal heart rhythms, nosocomial infections, pulmonary embolism, aspiration pneumonia, or else death also. Laboratory testing is entirely clinical and does not depend upon the bacteriological confirmation. Clostridium Titanium is recovered from the wound in only 30% of the cases. And it can be isolated from the patient who do not have the tetanus also. Hence, diagnosis is purely based on the clinical manifestations. Medical management. Tetanus immunoglobulin, that is TIG, is recommended for the persons with tetanus. TIG can only help to remove the unbounded tetanus toxins. It cannot affect the toxins bound to the nerve endings. A single intramuscular dose of 500 units is generally recommended for children and adults, with a part of dose infiltrated around the wound if it can be identified. Thank you. Thanks for watching my video.